Hello friends, today we are going to discuss regarding ethical and legal issues and responsibilities in medical records, which is chapter 4 under the subject MHA 401 of 4th semester management and medical transcription. So let's begin. So as you can see, today the outline of the course that we are going to discuss today is what are the different types of documents which are usually written and the forms which are filled by physicians, how we write it, how we fill the documents, and what are the ethical, professional, and legal implications if there is a failure to write down the medically relevant documents and forms. So, what are the various types of medical records that the doctors write? So as you can see in the slide, it is the birth certificate, the death certificate, the medical reports, the prescription, the medical records, the sick leaves, the certificates of the patient attendance. So these are the different type of ethical, as well as the discharge summary. Then you can also, like, there are autopsy report, there is a death certificate, like I already told you. So these are the different types of legal medical records which are being written by the doctors. So what would happen, like if you think, and what would happen if any of these documents is fake? Okay, like what are the ethical and the legal implication of such a thing? What would happen to the doctor, to the hospital, to the community if any of these documents is fake? So it's okay to be nice and not let your patient down. This is basically one of the emotional factors that might prevail in the mind of the doctor, and the doctor might be forced or maybe pushed to write a wrong report, which is ethically as well as legally not correct, and there are implications for it. So as you can see, why do we need to know about the ethical issues in reporting? So there are four basic areas for which we need to know that what are the ethical issues involved in reporting. Number one, the doctors enjoy the authority to sign a variety of documents that will lead to grave consequences if they are abused. Okay, because see, the doctor, being a doctor, you will be registered with some, with some council, government council, like in India you have been basically registered with Medical Council of India, and every state had its own Delhi Medical Association in Delhi, or you have got West Bengal Medical Association in West Bengal. Okay, but all of them are under a blanket umbrella of National Medical Authority, okay, which was previously your MCI. And now, like, the doctors enjoy the authority. We have their signature and their stamp, and their registration number with the MCI gives them the power to the authority to sign a variety of documents. And which are these documents? They are the death certificate, the medical reports, they are the sick leave, and the other 7 to 8 documents which I have just explained it to you. It is very important for the part of the doctors to ensure the correctness of the information before signing any document, because there are legal implications, there are ethical implications. Now, what is the legal implication? For example, you have given a leave certificate or a sickness certificate to any of your patient, okay, and the patient have committed a crime during that time. So you have said that the patient was you are admitted to the hospital, but in actual the patient was not admitted, and during that time the patient has committed any crime. So it will come directly on the part of the doctor that the doctor has issued a false medical certificate, and he or she might be sued in the eyes of the court, and they might also not only get imprisonment for their, or even their medical licenses can be cancelled. So these are grave consequences, because it has an impact on the society. Because see, we need to understand over here that any profession is respected by the type of work you do and the type of impact it creates in the society. So doctors, being the topmost of the medical professionals, they they command tremendous respect from the society. But as you know that every right is bound by a duty, so their duty is to ensure the correctness of these documents, because these documents can be fake, can be false, can be misleading, and therefore it might have got a lot of implications. And if they don't follow or recognize scientific and administrative standards, so it has got its own legal complications. Similarly, the various certificates, for example, like disability certificate or the medical report, then again they have also been under various code of ethics. Like here you have seen Saudi code of ethics. Similarly, in India we have got Indian code of ethics, we have got American code of ethics. So different country have got different code of ethics. So this is a very important criteria. Similarly, if you see, similarly if you see the next category where the medical records are very important, and it has got a huge implication in the medical care or the medical care services, is your medical prescription. Medical prescription is one document in which the doctor documents all the medication and all the medical advice which is being given to the patient regarding his or her illness. So it is not permissible to prescribe any restricted drugs except by the authorized doctors. So it is basically, so all the drugs which is being prescribed can be only prescribed by the respected authorized doctors. Similarly, the restriction which is related to these drugs should be followed, and the medical practitioner should not write a prescription only for pleasing his or her patient or the patient's relatives. So in order to please, and then the loyalty of the patient will be with the doctors, and irrespective of anything, the patient will come and consult the doctor whenever it is required. So these factors play a very, very important role in such a scenario. So, similarly, some of the important guidelines as far as the ethical and the legal issues is concerned, that all the medical records which is being prescribed by the doctor should be written in a clear handwriting. It should be readable. It should be visible. Okay, it should not bring a different, a wrong, resemblance to any other drug, because again it will lead to sentinel events. Sentinel event is that event which has the potential to cause potential harm to the patient. So that is very important. Similarly, you have got healthcare practitioner's name. Whenever you will give the prescription, it will comprise of the prescriptioner's name, signature, institution in which he or she is working, date of prescription, their medical registration number, then all the patient information in terms of the diseases regarding the various drugs, diagnosis, drug dosage in its pharmacological form, as well as the dosage, the dosimetry of the medicine, as well as the duration of the treatment, all have to be mentioned very clearly. So these are all a part of the patient record, and these are all reported, and it is being prohibited for a pharmacist to dispense any medication without the prescription issued by the physician, which is very, very important. And as far as the Indian law or the Saudi law for practicing healthcare professions, this is a very standard practice. Okay, now what is what are the various aspects that a medical record should have? So a healthcare practitioner which is employing the doctor should keep this is as a precise paper, and in the medical record they are for the patient, and it will contain the important or the appropriate clear for clinical findings, the decisions of the doctors, as well as the feedback in terms of like what has been evaluated, decisions and the procedures made, the information which is being given to the patient, the previous prescription, the medications, along with their dosage, okay, the duration, everything has to be mentioned, apart from the patient's overall investigation, whether it is CT scan, MRI, blood test, the value of the blood test, so that all the things can be correlated, and accordingly a safe plan can also be means exhibited by the government. So the medical record, it is very important to be kept in a safe place, and it should not be assessed or handled unless by those who are professionally related to the patient, and all the procedures related to the professional confidentiality should apply to all its content. So this is a very, very important factor. So these medical records basically, we have been discussing the medical records. So two points we have discussed over here. So the third point is all the contents of the medical records are the property. So who is the owner of these medical records? They are basically, the it is the property of the institution. For example, if you are working in Apollo Hospital or Max Hospital, so it is the property of the patient, of the hospital. So with the patient which is receiving his or her treatment, but the patient can have, in all these cases, the patient can have access to the record. For example, the patient can go, in cases of the investigation, he can directly go to the investigation department, to the lab investigation, to the MRI CT scan, and can demand a copy of both the actual procedure as well as the report which is being signed and reported by the doctor. And similarly, it can be also copy, because usually all the in today's world, in EHR, electronic health record, they have been updated in the system and can be accessible by all the doctors whosoever is treating the patient, or who is under the supervision of the doctor. So in such cases, you can always request upon a duplicate copy in case you want to consult to somebody else, because those people who are working in that hospitals can have access to the centralized medical records. In cases of the event, like I said, if you got it just photo stated, or you have taken a picture, you can also send it to another doctor and practitioner, and he should also provide the consultation depending on the information which is there in the patient, in a very precise and objective manner. And whenever we are writing the data or the information, it is very important that scientific and administrative standards should always be followed when writing every document which is related to the medical record, because it is a very important, confidential, and even a small error can have grave consequences. At the same time, when you want to change or modify any of this medical record, then the date of modification with a proper signature, and it is and all the other things need to be also been documented, so that it is all being documented under a separate sheet, and none of the information should be missed out. So it is very important for the same.
मालूम क्या है, इतना हो गया। अब चाहे दो में हम कन्वर्ट कर लेंगे, एक बार चेक कर लेना फर्स्ट टाइम, ऐसा ना हो कि हम लोग पूरा बना लें और
Okay, friends, now we are going to start with the part B of the ethical and the legal issues in medical records. As you can, recall what we have discussed in the last class. So we have discussed regarding the medical reports, and what are the important aspects of the medical records. So one of the medical record and important medical record are the medical reports. Now, what is a medical report? So you can see in the slide, a medical report is a healthcare professional who shall use due care in diagnosis using the appropriate technical means, as well as any specialist or assistant the case may require. So we will provide the patient upon his request with all the reports. So medical report may include any investigation. It may include the diagnostic investigation, including the MRI, CT scan report, or any Doppler test. Okay, and they are basically observed. The medical reports are basically observed, basically for its accuracy and objectivity that is being achieved. Okay, so these are as per the duties of the health professional towards patient, Article 15. So these are important aspect. So before writing any of the medical report, one should have a talisman in order to, it's very easy to remember a talisman in order to just to follow the standard operational procedures in writing a medical report, and none of the information should be missed out. So in such a case, we have to ask, like, what class does the report fall into? Okay, whether it is a normal or it is a medical legal case, if there is any assault on the patient, which might also include the police, or the any crime has been perpetuated. Similarly, the patient have been given the free and the informed consent regarding the report, or regarding the regarding the investigation, or it is the discretion of the parent or the guardian. And similarly, like, who will gain advantage from this report, whether is the patient itself, or is the it is the the hospital or the staff. That is a very important aspect. And what is the consequence of giving this report as opposed to not giving it? Now see, in there are certain sensitive cases where the decision of giving the medical report or not giving the medical report, for example, take a medical negligence has been done by the hospital, and the hospital is trying to save its own skin. So in such a case, there might be a possibility that the hospital may try to fudge certain information so that they are not being sued, so in the eyes of the court. So as a result of which, it is very important, like how we are reading that information, how we are understanding that information, and how we are trying to decipher the consequences in the long run of such a medical report. And then it is also important to establish that how much valid is the information, what is the validity of this information, and what are the differences or the key factors on which this type of validity is being measured. So then it is also important, like whatever in the medical report the statement has been written, so it is an opinion of the specialist or the doctor, or it is the opinion or the judgment which is being requested rather than the factual information in different type of circumstances. And if the patient is truly comfortable in complying with the requirements what is being written in the report, that is also a very important factor to understand. Then if we see, like when you are writing a medical report, we have to ensure that none of the information is false or misleading. And if it is so, then we have to take reasonable step to verify the information in the report. We should not deliberately leave out any relevant information, okay, because in order to favor somebody, in order to have a there might be certain issues which are very important to discuss, and they have an implication in the long run. So we have to complete and send the entire medical report without any unreasonable delay. We have to restrict the report to those areas where we have a direct experience or relevant knowledge, and we have to ensure that any opinion that we have included is balanced, okay, it is not biased, and we are able to state the fact or the assumptions on such a basis. These are the important key relevant point. And then suppose you are writing a sick leave, okay, like I have just in an example I was just giving you earlier. So suppose you are so what is the name and the address, who has written it, who is issuing it, what is the name, what is the address, what is the qualification of the practitioner, what is the name of the patient, what is the employment ID if the patient is in a corporate job, then what is the employment, or in any of the government job, then also the employment ID is going to help. At the same time, what is the date and the time of the examination, how much time has gone, and what type of feedback has been given, and whether the certificate that is being issued as a result of the personal observation by the practitioner during an examination, or as a result of information which is being received from the patient or other relatives, which is based on the sound medical grounds. So these are the important factors that needs to be included in the medical report, or even in the sick leave. Then similarly, there has to be a description of the illness from which the patient is suffering, okay, that is an important part. And then just a minute, yeah, description of the illness with which the patient is suffering, and the practitioner shall merely specify that according to his or her opinion, what is the what is the how the patient should go, okay. And the patient, if it is not totally disposed of for duty, and whether we need to give certain less strenuous job to the patient. So that is also important. What is the in a sick leave, what is the exact period of recommendation of sick leave, whether it's 5 days or 7 days, and then what what whenever you have the illness certificate, so the date of issues and the signature and the proper stamping has to be put, as well as the initials and the surname has to be put in block letters, as well as the stamp of the practitioner who has issued the certificate has to be there. So these are the important terms and conditions as far as the sick report or the sick leave is concern. So once it is being given to you, it is very important to maintain the confidentiality. Now what is confidentiality? So as we can see, confidentiality is the right of an individual to have the personal identifiable medical information kept private. So every patient would not like to disclose his or her clinic with any other person, because there's an element of privacy. So it is very important to maintain the privacy and the confidentiality of the patient. And the confidentiality, what is confidentiality in simple terms? It is also being named as the right of an individual to have personal identifiable medical information. Okay, so when a person, all of us will have a personal identifiable medical information, and we want to keep it private. We don't want to share it with everyone in the clinic, or even we will want to, for such information to be passed to another doctor or the healthcare professional, or to any insurance company, is when it is absolutely and very much necessary. Okay, for example, in terms of crimes, in terms of any other injury. At the same time, as far as the I've just explained you the concept of confidentiality. Now from here we will understand what is patient confidentiality. Now patient confidentiality means that the personal and the medical information that you will be giving to the medical provider, they should not be disclosed to anybody else unless the individual or the patient has given specific permission for such a release. So this is a very very important concept, because it has to be maintained at all costs. It is referring in terms of your various patient rights and the duties of the patient. So these things play a very very important role. Now we need to understand that, are all the medical records always confidential? Yes, majority of them are. And you can have full right to disclose. Ideally it should not be disclosed, but it can be disclosed only at certain occasions. For example, when there's a public health reasons, you have been reporting the birth and the death of the patient, whether it's a child or an adult or an elderly, when there's an clinical child abuse or neglect. I would like to discuss over here a very very important case which is being quite often seen in the western countries. It is known as the battered baby syndrome, BBS. Now battered baby syndrome, it is a very interesting phenomena seen in the UK, when the babies as young as 2 months, 3 months, 4 months, 6 months, 1 year, they came to the hospital in a situation when they used to cry. Now when the doctors investigated and the x-ray has been taken, it was seen there are multiple fractures onto the body of onto the such a young child, or a toddler, or such young children. Okay, and it is being seen that there are cases when there is a single mother, and because of frustration, because of the age of the mother was less, and there's no social support, they, out of their anger, they used to hold the babies in the hand and used to shake them very violently. As a result of which, as you know, the children are very sensitive and the children are very fragile. So it resulted in multiple fracture sites. So certain sites where the fracture has been healed, and there are sites where it is not healed. Okay, so we need to see in such cases, it is very very important. There are other cases. There are other cases where you can also report them in cases of when you have been reactions to the sulfur drugs, or due to reactions there's an anaphylactic shock, or you have been using a mesh in the stomach and it is causing a reaction, or because of allergy, and with the medical products. Similarly, in cases of epidemics, for example, just now in cases of COVID, so anybody who is being seen with such a symptoms, it cannot be kept confidential, and it has to be brought into the notice of the international health organization like the WHO. So in order to help to control of the spread of the disease, or to notify any person whose health or safety may be threatened, these things can be reported to anyone without the protection of the confidentiality clause. Then there are also there are activities which is being defined by the law, when there's an audit or an investigation or an inspection by the government, or a license renewal, where the records can be scrutinized, they can be seen for their authenticity, and likewise further certification or the permission can be given. Similarly, if you can see, like it is very important, like as per the article 21, healthcare professionals shall maintain the confidentiality. So see, by rule, like I have told you, confidentiality is a very very important thing, and it has to be maintained, which is obtained in the course of practice, and you may not disclose it to anybody. Anybody means anybody, okay, unless and until these are the following cases. So what are the cases? Like the cases may be, when you are reporting a case of death in cases of a clinical emergency, okay. So here you are basically, you can basically report it in case there is a crime, okay. There is a assault, and you have to report it to the police, you have to report it to any other human right organization, like such. When there is a reporting of communicable or an epidemic disease like the COVID now, okay, or there can be any other disease, similarly you have to report it. Then a professional refuting allegations pertaining to his competence. Now, for example, if the doctor is competent enough in order to do the surgery, and then in such a case there a blunder has been done, a sentinel event has been created, then again a committee can be made and the things could be seen, and further allegations can be put by the patient family, and the doctors have to refute them, depending on the competence or the conduct of the professional, depending on the declaration which is being made by the patient or the family. And if the party unanimously, they all concerned agrees in writing, and it is beneficial to the treatment, then such a case can, for example, like cancer, in such a case, whatever trials has been then committed to the patient, then such a thing can be documented or reported by some other agencies, and because it is beneficial for the whole mankind in a larger run. And if in such a case, in any case of legality, or when there is a criminal procedure act, okay, and then there are certain legalities which is involved, so it has to be ordered by the judicial authority. Similarly, the disclosure of the information has to be made in the eyes of law, in order to seek the truth. So these are important points. And similarly, as far as the article 30, the death certificates again has to be issued by the physician which is requested to conduct a medical examination. Now, for example, because the real cause of death has to be ascertained, and there is no unnatural death which is being seen, it should be a natural death. And if the doctor feels that there is a case of unnatural death, then it has to be again mentioned to the local police, so that they can investigate the thing, and the real culprit can be nabbed, or the real truth can be deciphered, or it can come out. Similarly, in cases when there is other aspects, or there is any situation which is beyond, then it has to be notified to the competent authorities, including the central government or the state government. So these points make these things very very clear. And then, one of the very fine things, and which is very important in today's world as far as the confidentiality is concerned, that is called the HIPAA. Now, what is HIPAA? HIPAA is a federal. It was made in the US, and the full form of HIPAA is Health Information Portability and Accountability Act. So what is it? It is basically wants to protect the baseline in protection to all type of health information, because see, in today's world you never know, like what the marketing companies, how they are going to, for example, your data on Facebook or WhatsApp, or it there they can be given to any other. If suppose you have got an Aadhaar card, or your Aadhaar card is linked to your banking details, so how we can ensure that all these data which is there in the computer or in the central system or in the database, it is all secured, okay. So similarly, as far as the health is concerned, there is a very strong act which is being created by the federal government. It is known as the HIPAA. So HIPAA is basically a complex law, In the US, particularly now in India, nothing like HIPAA. Now, slowly and steadily, the developing economies are thinking of in order to use this information and to keep the privacy of the patient in a strict manner, so that this information cannot be shared or cannot be used by any other company. So it's a complex law. It is governing the exchange of the health information among the healthcare. So what who are the various stakeholders? The stakeholders are the healthcare practitioners, they are the medical insurers, they are the various health businesses. Okay, so what is it is all about? It basically, you need to remember it, that HIPAA basically protects the confidentiality of the individual's identifiable health information. Now there are four words: IIHI. Okay, so this is very important, individually, because every individual is different, their health information is different, and there is a way to identify this health information. So ideally, it should not be identified very easily, and it has to be coded properly. And what is the health information? So health information means it is any information which is either oral or recorded in the form of a medium, in any form or medium, that is created or received by a medical health provider. So any doctor is providing, any hospital is providing, any health plan is providing, any public health authority is providing, any employer is providing, any health life insurance is providing, any school, college, okay, any healthcare. So it is any information which is created or received by the health practitioner, and it has to be maintained, the confidentiality has to be maintained. And either, in case you want to seek this information, then permission has to be sought, not only just from the patient but also from necessary authorities, if anybody is involved in such a case. And it can be also be related to the past, present, or future physical or mental health condition of the individual, and the provision of the healthcare which has been provided to the individual on a past, present, or a future payment for the provision of the healthcare to an individual. So these are the different categories of health information which has to be maintained, the confidentiality has to be maintained, and the major word in this is it should not be misused. So to prevent the misuse of any health individual identifiable health information, HIPAA is being created. So with this, we have come to the end of this lecture. Thank you so much. Thanks for watching, and for any further details, please log on to our website, and we assure you that we will be presenting you different type of information and the various chapters in a very informative manner. And hope you all like this video. Thank you so much.